Hello, my name is Nana Barnes, and today I'll be talking to you about macrovascular disease and diabetes. As a means of introduction, we're going to have a few objectives. We're going to talk about the importance of macrovascular disease, the types of macrovascular disease, how does diabetes and macrovascular disease relate, and how you living with diabetes or not living with diabetes be able to reduce your risk of macrovascular diseases. As a means of introduction, we'll talk about diabetes. What is diabetes? Diabetes is a chronic disease where you have abnormal levels of blood glucose. Abnormal levels of blood glucose as a result of insulin, which is a hormone produced by your pancreas in your body. Now, the pancreas may not produce insulin at all, or may produce some insulin but not sufficient, or may produce some insulin which is sufficient but might not be able to work at the target organs. So with these three situations, what you have is a resultant abnormal levels of blood glucose, and that is hyperglycemia. This results in type 1 diabetes, where there's no insulin produced, type 2 diabetes, where some insulin is produced, and gestational diabetes is diabetes seen and diagnosed in pregnancy. There are other subtypes of diabetes. Now, all these types of diabetes will result in macrovascular diseases or macrovascular complications. Like the name suggests, macro means big, vascular is talking about your vessels, your arteries, and your veins. So these types of diabetes are able to cause macrovascular disease or macrovascular complications. Macrovascular complications, you're talking about the heart and the vessels. So they are also known as cardiovascular diseases. So these are the heart and the vessels. The vessels go to every part of your body, importantly the brain, and then your peripheries, which is your hands and your feet. So macrovascular disease, we are talking about diseases involving the heart, the brain, and the peripheries or your extremities. The relationship between macrovascular diseases and diabetes is important. So you're talking about hyperglycemia, which is abnormal blood sugar, abnormally high blood sugar, and insulin resistance. These two result in damage to your vessels. They cause plaque deposits, narrowing the arteries, and also destroying the arteries such that target organs or the organs in which these vessels go to have problems going on. So what problems occur? So in the brain, destruction of these arteries or veins will result to either a bleed or a clot, and this will result in a stroke. When you're talking about the heart, when there's damage to these vessels which supply the heart, a plaque can be formed and a clot may result and you may have a heart attack. With regards to your peripheral vascular system, damage to the vessels which supply the hands and feet will result in decreased blood supply, which is ischemia, and result in death of the feet, so that will result in gangrene. These components are very important because they are associated with a high mortality or a high death rate. It is reported that people living with type 1 diabetes who die, more than 44% is as a result of cardiovascular or macrovascular complications. For people living with type 2 diabetes, more than 50% of the deaths are as a result of complications of the macrovascular system. So this is vital that if you're living with diabetes, you're able to manage and take care of yourself to prevent yourself from getting macrovascular diseases. If you don't have it, you prevent yourself from getting it. How would you be able to reduce the risk? First and foremost is lifestyle changes. Lifestyle changes are inexpensive, but very difficult for people to initiate. Once you start it, it just continues and you'll be able to do well. So what do you do? The first thing is a healthy diet. Healthy diet doesn't mean ignoring everything. It means eating the right thing at the right time and increasing your complex carbohydrates, which would decrease or prevent your blood sugars from going very high, replacing the simple carbohydrates, which are like fine sugars, with complex carbohydrates like vegetables, and also having fruit and healthy snacks, having less processed foods and more natural foods. Exercise is also very important. The WHO recommends that we exercise at least 30 minutes a day for a minimum of 5 days in a week. This will help you to reduce your weight because weight gain or obesity is associated with insulin resistance, and we do not want insulin resistance to increase because it's associated with an increased risk of macrovascular diseases. Smoking The toxins in smoking destroy the vessels. So reducing smoking will also reduce risk of peripheral artery disease. Alcohol increases the risk of high blood pressure, and this is macrovascular disease. So reducing or stopping alcohol is going to reduce the risk of macrovascular diseases. A little checklist to help you also to reduce your risk of macrovascular disease. When you go to the hospital, make sure that every time you go to the hospital, your blood pressure is checked. Targeted blood pressure is less than 130/80. Now, if your blood pressure happens to be more than this, you discuss with your healthcare provider, and you may have to set in measures like the lifestyle changes or put your medications to be able to reduce your blood pressure to target. Blood sugar targets also should be set, or blood glucose target should be set. You should discuss with your doctor so that you do a home monitoring of blood glucose. You also have a target HbA1c. For the general person living with diabetes, the target should be less than 7%. However, if you have too low blood sugar or hypoglycemia, you have an increased risk of macrovascular disease. Too high is also give you an increased risk of macrovascular disease. So discuss with your doctor to be able to come to a target one and stick to it. Lipids or cholesterol. This is associated with increased risk of macrovascular disease. You want to reduce the bad cholesterol, which is the LDL cholesterol, and increase your good cholesterol, which is the HDL cholesterol. Reducing your cholesterol, your target should be less than 70 milligrams per deciliter, and increasing your cholesterol, your good cholesterol HDL, to more than 40 milligrams per deciliter. Aspirin use is also important. It's a bit of controversy, but some people believe that it can be used in the primary prevention and secondary prevention of cardiovascular diseases. Ultimately, you should make sure you have eye examinations, annual eye examinations, annual kidney examinations, liver checkup, and then your feet. Examine them personally every day in the house, and also have a health professional at least once a year do a full clinical examination of your feet to be able to detect any problems which are going on, which can be curtailed and taken care of. Ultimately, your health lies in your hands, so make sure that you are in control when it comes to taking care of your health. Health comes first. Take care of yourself to be able to live a long and productive life. Thank you.